So while we're waiting, maybe you can just slide to the next slide, and I can give a quick introduction of Arioneo and our products for the people that weren't here for the first webinar. So as you may know, Arioneo is a company that produce technology that are dedicated to monitor the athletic horse performance and health. So we have two brands. The first one is the training solutions with equimeter. If you can just press the next button. So equimeter is a technology that monitor the racehorse training. So it collects cardio, GPS, and strike data to help trainers optimize their horse's performance and health. And we will see how it works in real life with Emmanuelle webinars, actually. And we have the second brand with the vet services. So we have two products. The first one is equimeter. So it's actually kind of the same as equimeter, but it also records a scientifically validated ECG, so to detect arrhythmias or other cardiac pathologies. And we also have equisim. If you can just press the next button, you can have the two products name. Yeah. And so the last product is equisim. This is a veterinary tool that helps veterinarian to diagnose asymmetries because it quantifies locomotion data. I thank you. Mike, are you here? No, he hasn't arrived yet.
No problem. We can
start without him.
We can start without him.
Yeah.
So well, I'm Dr. Emmanuelle van Erck. I'm equine veterinarian specialized in equine internal and sports medicine. And today we're going to follow up on two other webinars that were given by Dr. Michael Davis on the physiology, on how horses work during exercise and what makes them such exceptional athletes. And we also saw with Mike how these horses can be limited by fatigue. So the aim here today is really to share with you an experience on what do we do when we have horses that are poorly performing? Where do we start to look? And how can we be a little bit more objective in the way that we look at our horses? Because ultimately, the thing that we're all aiming for is winning in sports. And what an incredible feeling it is when you actually make it and win it. But sometimes it doesn't go as expected. And as we saw with Mike's webinar, there are a few things to understand to know how the horses work and how they can be limited. What is very important for horses to be able to work and perform is what we call the oxygen transport chain. It's the transport of oxygen from the outside ambient atmosphere into the respiratory system, distributed by blood and pumped by the heart, and it goes to the muscle where it is actually used to fuel energy. But we also saw with Mike that horses can be limited by the respiratory system. If one of them is the limiting factor, it is the respiratory system. In humans, it's the heart. We've got tiny hearts, but horses have massive hearts. So they're seldom limited by their hearts, but they are limited by the respiratory system. And I put these two pictures together. This is on the right, a guy that has managed to escalate to the top of Mount Everest, and on the left, a racehorse arriving at finish line. Well, there's actually no difference between the two in terms of the amount of oxygen that they have in their arterial blood. The only difference would be that the guy on the right is wearing an oxygen mask, and a horse can't do that. So he arrives at the end of a race, even if he's the fittest and the most talented athlete, he will experience a deficit in oxygen, what we call hypoxemia. And that deficit in oxygen is something that can be performance limiting ultimately. Now, it's not that obvious because often deficits in oxygen translate into premature fatigue, not necessarily into respiratory symptoms like a horse that's coughing or a horse that would have nasal discharge or that would be breathing heavily. Really, fatigue is the first motive for referral in these horses. I see a lot of show jumpers in my clients, and these would tell me, well, I have the impression I'm riding a cow instead of riding this top level athlete. So that is the number one thing that must come to mind when a horse is abnormally tired. Now, respiratory diseases are really highly prevalent. This is the result of a retrospective study that we did on over 400 horses that had poor performance. And we had horses from different equestrian disciplines. And you can see that whatever the type of sports that the horses are involved in, there is a very high prevalence of horses that have respiratory disease. If we look here on the right, the total is over 80%. That means that respiratory diseases are a major cause of poor performance in horses, whatever type of poor performance they have. And that can be explained by the fact that instead of being out in wide open pastures, these horses are housed indoors and they inhale a high quantity of particles that can challenge their respiratory system and cause inflammation. You have multiplication of over 50 of the amount of dust that a horse can inhale in his environment. And this dust can be composed of course, mineral particles, but also organic particles or microbes like bacteria or fungus. Horses were actually designed to do this, to graze in the open all day. And it's also important to remember that this is what their digestive system is adapted to. Because we use them for sport, we want to increase the amount of energy that we're going to give them. And that is usually under the form of commercial feeds or cereals. That can have also an impact on their digestive tract. A negative impact if we're giving too much starch. It can cause gastric ulcerations, fermentations that can lead to colic. So it's very important to bear in mind that nutrition is an essential component of your performance. We also saw in the previous webinars that the bone and the musculoskeletal system had to adapt with training. But it's important to know that you can have overtraining and you can overstrain and overfatigue your musculoskeletal system. This is a really interesting publication from Dr. Morris West that was recently published that showed that there was a direct relationship between fatigue, bone fatigue, and race distances and the overall workload that the horses were doing. So the more you're going to strain the musculoskeletal system, the more it's going to fatigue. And of course, the more exposed it's going to be to problems such as stress fractures, for instance, especially in racehorses. So if we were going to talk about poor performance, it would probably take weeks because there's so many things that are involved in poor performance that we need to think about. As veterinarians, we look at what involves the horse, his respiratory system, his cardiac system, his digestive tract, his musculoskeletal system. It's not just one of them that can fail, but it can be one or several or be linked to one another. But there are other things that are extrinsic as well that are very important and that influence the performance of all these systems. You have the diet, of course. You have the environment, the competitions, traveling to the competition, the stress of the competition, the fact that the horse is mingling with a lot of other horses that can challenge his immunity. You also have all the people that are involved around the horse. Oh, sorry, I'm going the wrong way. That's the rider, the trainer. They can have a direct influence on the amount of work, the type of work that the horse is getting. And it can be under conditioning or over conditioning. Other things that we think less about is the tack. If you have a saddle that's not fitting, a bit that is not adapted to the horse's mouth, that can really challenge the horse in his work and cause poor performance as well. Our challenge as veterinarians is that, unlike usual, we are looking at horses that are not sick. These are horses that are still involved in competition. The only thing is that they're not performing to expectation. So when we examine these horses, we need to find cues that indicate what is going wrong. And it can be challenging to do so on a resting examination in the horse's stable. So it's always good to look at the horses in movement. And there again, if you look at the horses trotting up and down, you might be missing some important things. The best is, of course, to look at your horses in real life conditions, in conditions in which you reproduce what the horse is meant to do. And during these exercises, you can actually measure a series of parameters that are going to tell you how the horse is responding to the workload that you're putting on him. You can also look at the interaction with the rider. Is the horse being defensive? Is the horse comfortable? Is there a good harmony between horse and rider? Now, all of this is very subjective, and it is interesting to be able to measure how the horse responds to the workload that we're putting on him. So having a way of measuring workload is important to know what response is elicited. Is it adequate to that workload, or is it not that good? There are a series of measurements that we can make. Some of them are more sophisticated than others. And I wanted to share with you today some very simple means of looking at the horses without having to recur to sophisticated equipment like a treadmill or masks that measure oxygen consumption. You can do some very simple things like looking at heart rate and motion. And fortunately, there are more and more systems that allow us to do so. Now, let me introduce you to my brother, Armel. Armel is not an elite athlete. He's an amateur triathlete, but he's been able to improve his performances during a triathlon by measuring his speed and his rate on Strava. So with his smartphone, together with his sweat, he's been able to progress and to eventually manage to win a medal at a triathlon. Now, this is really interesting because this smart wearable technology has become available for horses as well. It has been a slower adoption of these techniques because in the past, they were not very user-friendly. They required more sophisticated equipment. You needed to plug your system to the computer. You had a software that was not necessarily adapted. We have been working with Arioneo using the equimeter for a couple of years now, and we found it extremely user-friendly, very easy to use and versatile. And also, and most importantly, of course, it brings us some relevant information on how the horse responds to exercise. By measuring speed, for instance, tracing the horse over the course that he's taking, looking at the split times over that course, looking at heart rate, how does his heart respond to the workload, but also having ECG, which is very important. The equimeter also includes parameters that give us cues on how the horse locomotion is, stride frequency, stride length, and we can profile the horse's particular and individual stride locomotion through repeated measurements. And probably the most important thing is that everything that the equimeter measures has been scientifically validated. You can see here a screenshot of my smartphone when I'm trying to find my way to get to a client stable, and I absolutely have no reception, no network. It's very important that what you measure is accurate enough to be relevant. And all the systems that are included in the equimeter have been scientifically validated. So we know that what they measure are actually what the horse is doing. So now let's dig into what we can do with wearables like the equimeter. Well, this is a graph showing a group of 2-year-olds during training. And what we're looking at is the time they take to recover their heart rate to 80 beats per minute. Now I've put a line in red here to show you the average. And you can see that some horses are better than average on the left side, and some horses are worse than average. All the horses that were above that red line, the 6 horses that are above the red line, were horses that had different types of issues. And these issues could have been pain, it could have been a respiratory problem, or it could have been a cardiac problem. And they had to be addressed before we continued the training in these horses. So measuring a simple parameter like heart rate and comparing several horses to each other is a good way to start. But we need to know what influences heart rate, or heart rate recovery, or heart rate variability. These are all parameters that can give us an indication on the horse's health and conditioning. Well, first of all, if you've got a really large heart and you're a very athletically talented horse, because you've got good genes, then you will have lower heart rate for the same type of exercise than an average horse. Body weight also influences the heart rate. The heavier you are, the higher the heart rate, because it takes more energy to shift that weight. Stress and dehydration can also increase heart rate, and climatic conditions. So if you're working in a hot and humid climate, this will increase the heart rate for the same speed in comparison to a horse that is in a more temperate climate. Track depth, also an incline. Of course, the deeper the track and the more you have incline, the higher the heart rate. So that needs to be accounted for when you're going to interpret your heart rate response. Now, on the other side, at the level of the horse, training and overreaching can cause also heart rates to be abnormally high. And of course, all the clinical problems that can arise, like a horse that has pain, and this could be musculoskeletal pain, or it could be from the digestive tract. Horses that have anemia have higher heart rates because they have less red blood cells, so they're less effective at distributing oxygen to the muscles. Cardiac disorders, of course, will affect heart rate, but also a horse that has a respiratory problem. So let's look at a few examples here. This is a young thoroughbred that has been followed over time, and he's doing the same trainings over time. And you're looking at his heart rate recovery after 15 minutes. So you can see that 6th of April, he had good recovery up until the 11th of May, where all of a sudden his heart rate recovery worsened. So he has 3 training sessions here that are abnormally high in comparison to what they were before. Now the owners decided to race that horse anyway, despite the indications that the heart rate recovery was not quite as good. This is the horse that we're looking at here. This horse at the level of the rail here. And just like it started first place, and progressively he's going to lose ground and eventually lag behind, and the jockey is pushing and then stops pushing because he can see that the horse is not progressing anymore, and that horse finished last. When that horse returned to the stable, nothing special. couldn't detect anything in particular, no lameness. We had a look at the ECGs of that horse and his heart rate relative to speed. So here in gray blue, you've got the speed, and in red, you've got the heart rate. And you can see that the horse decelerates, so his speed just goes down, but his heart rate remains really high for a long period of time, and he remains above 100. He's at 130 2 to 5 minutes after the end of the exercise. The fact that you have a difference between your deceleration in speed and your deceleration in heart rate is usually reflective of an oxygen deficit. And so the horse maintains a high heart rate to compensate for that oxygen deficit for the time it takes for him to recover. Now, when we look at that horse's ECG, he had a lot of arrhythmias. These are what we call supraventricular premature contractions. Doesn't really matter. It just is an arrhythmia. And that arrhythmia is far too frequent during the exercise for the horse to have an effective cardiovascular function and to be able to distribute the blood to the muscles. So this warrants further investigation. And when that horse was referred to us, we could hear a slow, really mild murmur on the left side. And that heart murmur corresponded to actually quite a severe regurgitation of one of his valves. So this is the mitral valve, and it's leaking. Everything that you see in green is a huge leak of blood that moves backwards. And that can be a trigger for the arrhythmias that we saw. So this horse would have continued to train if that had not been detected earlier on. It was the fact that he was poorly performing that we went back and looked at the ECGs that were recorded during training. And already during training, we had cues that something was going wrong. So we should have looked at that earlier on, but of course we weren't there. The trainer should have told us that he felt that the horse was not recovering appropriately. This is not something that we can treat, but certainly you are not going to maintain a horse with such a cardiac problem in training. It would be completely counterproductive, and it could become dangerous because the horse could develop atrial fibrillation, which is a far more dangerous type of arrhythmia. This is another example of a horse that was examined, or he was recorded with the equimeter during training. And the trainer felt that the horse was abnormally tired and he was not conditioning as well as all the other horses from that same group. His recordings on the equimeter showed that he had consistently high heart rates, but high heart rates meaning over 250 beats per minute. So we were very interested in looking at the ECG of that horse, considering such high heart rates. And we detected that he had atrial fibrillation. Atrial fibrillation is an arrhythmia that is caused by a dysfunction of the little atria, and it affects the way that the blood is distributed. It can be a very dangerous arrhythmia because it can cause what we call ventricular tachycardia, and that causes collapse of the horse. So it is not compatible with safe training and certainly not safe racing. This horse was detected at training even before any vet had seen him. It was just based on the trainer's feeling something is off. We record his parameters during exercise, and then the tracing can be sent to his veterinarian and a diagnosis can be made. This avoids any accident, and that's very important for the safety of the jockey, and the safety of the horse. With the equimeter now, we can see some things that we were unable to detect previously. So this is a horse that sustained an episode of nosebleed that corresponded to an exercise-induced pulmonary hemorrhage. And when we look at his tracing during training, we can see that he has an episode of atrial fibrillation that is not sustained, so it's called paroxysmal atrial fibrillation, right during that intense phase of exercise. When the horse goes back to the stable, he is perfectly rhythmic, and so you would not detect that on a resting examination. But that is the cause of the bleeding. So there's no point in treating that horse for EIPH for a respiratory problem, because the origin comes from the heart, and a heart dysfunction that happens only during exercise. So looking at these horses during exercise is absolutely essential. Now, this is another horse that is in atrial fibrillation, and here he is winning the European Championships. This horse was diagnosed with an arrhythmia 2 weeks before the championships. It was not present beforehand because this is a horse that was very closely followed. And this horse had this atrial fibrillation, but we did an exercise test and recorded his ECG during his exercise, during a time where he did his cure. And we saw that he was high in heart rate, but not dangerous enough to withdraw him from such a high level competition. So the level of sports is very important, but it's also important to monitor your horses over time. There is a publication from Chris Navas that is a review of the literature that's available that looks back at sudden cardiac death associated to exercise arrhythmias in horses. And there is a clear correlation between significant arrhythmias and risks of collapse and sudden death during racing in horses. So our aim is to try and avoid to have catastrophes, and these could be collapse like the picture I showed you previously, but it could also be problems like the ones that occurred in 2015 at the Melbourne Cup. This is one of many races where horses sustained a fatigue injury and had to be put down, very unfortunately. We've had horses that were monitored previous to a stress fracture, and up to 3 weeks prior to the fracture, we could see that the horses showed abnormal heart and locomotion patterns with the equimeter. So in horses with stress fractures, you can have arrhythmias that indicate that the horse is in pain. And it's a reason to refer these horses quickly to a vet so that you stop the exercise, you determine what's going on, and you can then safely turn them back to exercise. If you're interested in one of these cases, it is available on one of the podcasts that is offered by Arioneo on their platform. Now, of course, we can monitor these horses during training with the trainers, but we can use it as a tool also to check the horse's fitness and eventually detect some subclinical diseases. This is an example of an incremental standardized exercise test that we do in eventers. And you can see that you have the tracing of the outdoor track here, and you've got the incremental steps of speed as the horse does his exercise. Now, the reason why we standardize this exercise is that we can compare a given horse to other horses of the same level that have done exactly the same exercise and see if he is as fit and as performing. So it's a very interesting way of objectively evaluating fitness, and to monitor a horse's progress during the course of the competitive season to see if the training programs are adapted or not. But for us, it's also interesting because it allows us to measure a series of variables that can change when the horse is affected by a subclinical disease. Subclinical means that it's not obvious enough to detect with your usual resting examination. It also helps us to assess the functional impact. Remember the dressage horse that was in atrial fibrillation? It had low functional impact on that horse. He was still performing, but on the racehorse, it really caused problems like bleeding and poor performance. It's also a way of monitoring a horse that has had an injury, see how he's progressing and how we can safely return him to competition. This is an example of monitoring of eventer horses during the season. So on the graph on the top, you have heart rate, and you can see that in February, his heart rates were higher and that they decreased with conditioning in April. So this horse has a nice improvement thanks to his effective training. It's the same for the lactates. So lactates are measured by doing a blood sample. You take a drop of blood and you can use a handheld meter to measure lactates, and lactates will increase if the horse is not sufficiently trained or if there is a problem in the oxygen transport chain, because the less effective the use of oxygen, the higher the lactates. So similarly to the heart rate, you can see that the lactates are going back to lower values, meaning that your conditioning program is effective in this horse. Just a quick overview of lactates. So lactates measured by a blood sample. It can change if you have subclinical conditions like anemia, cardiac disorders, respiratory disorders, anything that will affect the oxygen transport chain. So to go back on our standardized exercise tests, we can do them in the field, of course, but we need to adapt them to the type of work that the horses are doing. We're not going to monitor with the same standardized exercise test a racehorse, a show jumper, or an endurance athlete. We've designed an endurance test for the endurance horses, and because these horses can do 120 kilometers to 160 kilometers over a day, you want to make sure that what you're measuring is relevant and reflects what the horse needs to do. So in this standardized test, we're going to walk the horse for 10 minutes and trot him for 10 minutes. And then we're going to go on a 27-kilometer canter at a given speed. We're going to measure continuously the heart rate and evaluate lactates. And then we're going to finish by 2 incremental steps, so shorter steps, but at higher speeds, so that we can increase the heart rate and increase the lactates. And here you can see on this, in this table, the VLE4, which is an indicator of the lactate accumulation. So the speed at which the lactate reaches a certain level is very different in healthy horses versus non-healthy. So if I have an endurance horse and I'm training him and I want to make sure that there's no problem, there is a standardized exercise test that I can do that can tell me if I've got the green light for the competition or not. We've done the same thing for all horses. This is another example of very simple standardized exercise test for sport horses, so show jumpers and dressage horses, where we are going to do twice 2 minutes of trot and twice 2 minutes of canter, measure continuously heart rate, and measure lactates over those 4 steps. With that test, even though it's very simple, we are able to discriminate between control healthy horses in pink and horses that are affected by a series of problems like lameness would be the problem that causes the highest heart rate in comparison to control horses. Of course, horses with cardiac problems also have abnormally high heart rates. SEA and MEA are a mild equine asthma and severe equine asthma. You can see that respiratory diseases also affect heart rate. If we combine that measurement of heart rate with lactate, we can also see differences. So the controls would have, of course, low lactates. Horses with anything that affects the distribution of oxygen will increase lactates. So, of course, cardiac disease, but also respiratory diseases, severe equine asthma and moderate equine asthma. Lameness is not as clear-cut. It's not significantly different from the controls, even if it looks slightly higher. So doing a little algorithm, I've got heart rate that is abnormally high, and I've got abnormal lactates. I know that I'm looking more at a cardiac problem or a respiratory problem. If I'm looking at a cardiac problem, I can look at the ECG, so I can already eliminate one or the other. If I have a horse with abnormal heart rate but normal lactates, I would be looking at a horse that has a pain issue like lameness. So doing a simple standardized exercise test, measuring some simple parameters like lactates and heart rate is effective in discriminating the underlying problems that cause your horse to be poorly performing. I don't know if we've got time for this case. Gabrielle, let me know.
Yes, no, you can go ahead. You have time.
What enthusiasm. Great. I hope everybody is as enthusiastic there. So I wanted to share with you this particular case because I've seen this case recently, and it has really showed me that how valuable exercise testing is. This is a 15-year-old eventer that was diagnosed with asthma. He's had several months of treatment, corticotherapy, bronchodilators. He has had some antibiotics at some point because he had a concurrent infection. But although he is slightly better, he is still not performing to standard. And because of his irregular performances, the national trainer decided he would not select him to be on the national team, which was a huge disappointment for the rider who had worked hard to get there. Now, because I wanted to understand how the horse was functioning during exercise, we did a standardized exercise test on an outdoor track. So it's a 800-meter sand track. And we're doing these incremental steps of canter. The horse is ridden by his usual rider. And we measure heart rates throughout and the speed. This is with the equimeter. You can nicely see the speed, the heart rate, the amplitude of his stride, and stride frequency. So this is a graph of his heart rates at all 3 steps in blue, and this is in gray, the reference values for the same steps from other horses. And you can see that he's abnormally high in heart rates and abnormally high in lactates. That gives me the indication that I have a problem with the oxygen transport chain. It can be a cardiac problem or it can be a respiratory problem. When I look at his ECG, this horse has abnormally high frequency of ectopies, of arrhythmias during exercise, during the steps of maximal exercise. So that is a problem. Now, looking at his heart, we can see that his heart, of course, is an athletic heart. It's a big heart, but the right side of the heart is very congestive. The right side of the heart is the side that pumps blood towards the lungs. And that tells me that the lungs are very congestive and that heart has difficulties in pumping, that he's incurring high resistance. And that's why it's swelling up. So we need to do something to improve cardiac function. Now, we did some samples in this horse and we showed that he had repeated episodes of bleeding from the lungs. We also showed that he had little fungus that were growing inside his samples, which is pretty disgusting. But it happens more often than we think in horses.
Chissà perché, penso me lo prende gli ultimi.
So this horse is treated for, again, for this problem, but the fact that he has fungus motivates me to completely disinfect the box, put the horse on shavings, steamed hay, and get rid of the birds that were nesting right over his hay net. And then, of course, I want to reevaluate him. So after treating him adequately, we look at his performance on the same exercise test that we did previously. Same riders, same track, same speeds. Let's see how he does. So you can see that it is a similar exercise through this first top graph, but you can see that the time of recovery on the last graph here, he has recovered in 1/3 of the time it took him last time. And here we're only at not even 3 months difference. So that horse is doing much, much better. Looking at the values of heart rate, we are below the reference values and certainly much, much lower than his initial values here in blue. So his new values are in orange here. This is not surprising because he's a top-level athlete, so he has lower values than the reference values when everything is going well. So this tells me that the treatment that we've put up is actually efficient, and it went through environmental management as well. Lactates, same thing, they start at the same level, but they rapidly go down. So this is a walk in the park now for this horse to do this standardized exercise test, whereas previously it was very tedious. When I look at the amount of arrhythmias that he has, I can only spot one during the entire exercise, whereas I had 10 times that in the previous tracing. I do my check of the heart, and the heart has gone back to normal dimensions, and that is because the respiratory problem has been addressed. So I hope that through this presentation, I've managed to show you that monitoring fitness with technology, with simple tools, can help us to monitor our equine athletes. It helps us to evaluate their fitness during training, but also to detect abnormal patterns that could put us on the trail of an abnormal problem, a condition that would impact performance. It's also, in horses that have sustained injury, a very good way of seeing how they return to competition. I think that the use of technology is going to be a real game changer. Right now, the way that we see horses is we have a horse that is poorly performing or that has an injury, and we do the diagnosis post-competition. So we're already looking at that horse. It's already too late. We should have looked at that horse previously. Now, with the technology, we can maybe focus a little bit better on what's happening beforehand. That's already what they do in human athletes. For instance, in football or soccer, if you're in the US, they have a standardized pre-competition medical screening, PCMA, and that PCMA is mandatory for all teams that are involved in international competitions. It encompasses the medical history of the athlete, a comprehensive physical examination, an ECG, and an exercise test. Something that we can actually do in horses as well. If we start doing that, looking at horses during training, not only can we assess their fitness and control their progress, but we can also detect subclinical issues and make sure that the horses that are registered to participate in a race are actually fit to perform, and that we're going to reduce the risks for poor performance, injuries, or other problems. So that's it with what I wanted to share with you. I'd be really happy to answer any questions if you have any.
Well, thank you, Emmanuelle, for this webinar. It was very interesting. So if you want to ask a question, you can just activate your microphone and ask the question, or you can also use the chat window if you like. And maybe before the audience starts to ask their question, I have one actually. So regarding the standardized tests you were talking about, I was wondering if maybe there is a way to design one that trainers or riders could do between the ones that are done with the vets, so that we can still assess the fitness of the horse between the periods.
You can do any test that you want to, actually. You just take your system to monitor what the horse is doing. So speed and heart rate, for instance, and you're going to look at the heart rate at a given speed or at a given pace. And then you're going to look at your horse's recovery. So you can standardize yourself, your own exercise. That's what we do in racehorses. It's very difficult to tell them to go at a given speed for young thoroughbreds. Usually, they canter or they breeze, but there's not a lot of variations of speed in between that. So if you standardize the duration of your test, the conditions in which you do it, you can actually yourself be doing a standardized exercise test for the same training session. You do the same recording and you compare your horse over time. And I guarantee you'll be fascinated by what you find over time.
Okay, great. And so what would be your advice for the trainers and rider to design the specific test? Like, if there are some parameters we need to check and some condition you have to follow?
You have to try and be as similar as possible from one time to the other. So for instance, if you have an outdoor track, and it could be a track that goes through the woods, for instance, well, you know that you're going to do a trot of that track, a warm-up, and then you're going to canter. As long as you do the same thing, the same amount of trot, the same amount of canter, same amount of recovery, and you measure heart rate and make sure that your speed is comparable each time, then there you have it. There you have your test.
Okay, that's interesting. So we have one question, oh, actually two. So the first one from Nina. So is there an explanation for eventing horses scoring 100% at respiratory disease?
Scoring 100%, meaning that
maybe Nina, if you want to, you can activate your microphone. Just gonna do it. Not sure if she's...
Hi, can you
Hello,
hear me?
Nina. Yes,
Hi.
we can hear you. Hi.
Thank you. At the start of the display, there was a graph on the respiratory system with horses showing in black for no respiratory disease and in red for respiratory disease. And the event horses,
right.
they're just already.
So this is a population of horses based in my neck of the woods, so in Europe, around Belgium, Netherlands, France. Mm-hmm. In eventing, they have a very traditional way of keeping their horses, meaning that they're often on straw with dry hay. The quality of hay and straw in the past 20 years in Europe has really gone down because we don't have winters that are as cold, and so the soil is not as clean, if you want to. So I think that that can be an explanation for the horses that we saw referred for performance. 100% of them were affected by respiratory disease. There's also the fact that these are slightly older horses, and so they would have been exposed for a long period of time to a lot of dust, and not necessarily have been treated or monitored for that.
Okay, thank you. So it's just stable conditions and not
Yeah.
so much the type of work or the way we train.
No, it's really the environmental conditions and the fact that they're a little bit older.
Yeah, okay. Thank you so much. I really enjoyed the rest.
Thanks. Thank you, Nina.
So we have another question from Mark. Do you want me to read it?
Well, I have it here, but we might read it. We have a 2-year-old racehorse with a max heart rate of 229, and his recovery at end is around 90-95. He's a promising racehorse. Then we have had horses with lower max heart rate and a quick recovery, but aren't as competitive. Is the max heart rate a concern, or is it more the recovery time? Really good question, Mark. The maximal heart rate does not have any relation with the athletic capacity. So some horses with very high maximal heart rates can be better than horses with lower heart rates, or reciprocally. It really doesn't matter. What is important is the recovery time, and that's a more valuable marker than your maximal heart rate. Recovery around 90-95. It depends, when you take it. If you standardize the time that you take it for all the horses and he's slightly higher, it can be also that he might be more competitive and so a little bit more stressed because he wants to win. But certainly if you have the impression that he's sweating abnormally, or that he is breathing heavily, then I would certainly just have him checked, have a vet put a stethoscope on him.
Thank you both very much. This is Maximus Wind over in the Western Hemisphere. A question, Doctor. Could you see a benefit to this if you'd put it on some younger foals and they were able to be monitored from their earliest days, maybe just like a little elastic belt strap they wear, and see some early evidence of which ones to maybe call out and which ones to continue on with? And thank you in advance.
I'm not sure, actually. We've never done that. I know that some breeders have tried pre-screening by doing a cardiac ultrasound to see the size of the heart and try and see the ones with larger hearts if they actually manage to be better. But I think it's probably more valuable once the horse has a little bit of work on his back to monitor them, because there's so many things that can switch on when they get into work, and the way that they respond to conditioning is also relevant on how well they're going to fare later on. So I'm not sure monitoring foals would be that interesting.
Okay, thanks.
I was just wondering if it was from, if it was from the standpoint like they're out in the field and they're running around having a little bit of exertion, so it's not an at-rest reading that you're getting. Yeah.
And that would be difficult maybe to standardize the readings according to the amount of work that they do. Some might be more active than others. I'm not sure. It's never been done before. So maybe if you want to try it out and tell us what you find, that would be interesting. But they did some studies on little foals or younger horses that were out at pasture and that had their own training, and they compared them to horses that were put in early training and then compared their progress, and there was actually no difference. So the horses that are left in pasture to train themselves are actually doing really well. Okay, there's another question, I think.
Yeah.
Do you want to read it, Gabrielle?
Yeah, so we have one question from Liz. Great session, thank you. I was very interested in the EIPH case study you mentioned. Do you believe episodes of EIPH can often be attributed to heart issues, such as atrial fibrillation?
Yeah, definitely, I think so. And I think we're not looking at it hard enough. And even problems lighter than atrial fibrillation, so a horse that would have premature ventricular or atrial contractions during intense exercise, can have bleeding. We're conducting a study right now with the Hong Kong Jockey Club looking exactly at that. Horses that are doing barrier trials, and we see that we scope them after the barrier trial and have their recording with the equimeter ECG. And we're trying to see if the horses with more frequent arrhythmias are more at risk of having EIPH. And we're still analyzing the study, but it looks like it. So certainly any disruption in the distribution of blood can cause transient hypertension, excessive pressures in the lungs, and cause EIPH. It's when we have a case of EIPH, we will systematically look at the heart and try and record an ECG during exercise, because we feel that if we just treat the lungs, we're missing a very important aspect of the cause of EIPH.
Thank you very much. Thanks.
You're welcome. As I mentioned also in the presentation, the arrhythmias can be generated by other things like pain that would be induced by locomotor issues, but we've had it also with horses with severe gastric ulcerations, had arrhythmias during exercise. We treat them for that and the arrhythmias disappear. So something to think about.
Okay, so we have one more question from Caroline. So how long before an important race or competition should a horse be fully examined to prevent rather than understand why he may have performed poorly?
I think it's as early as you can. So in racehorses, for instance, we'll equip them with monitors at the onset of the season and really follow them over time. And that's where we're going to be the most efficient in detecting what's going wrong. The longer we have, the more we can identify the horse's individual capacity and individual response to training. And that's where we're more sensitive in detecting when something is going wrong.
Thanks. So I hope it answered the question. We have one more from Lara. So thank you for the great presentation. You showed some data of the exercise test for sport horses that was able to discriminate between healthy controls and horses with cardiac, pulmonary, or orthopedic issues. How many horses were involved in this trial?
475. So we had 475 examinations and we had about 50 controls. It's a bit less than that.
Okay.
We do it on a very regular basis, so we've got it. Yeah. Okay.
I think we don't have any more questions, so we're going to put an end to this webinar. So thank you very much, Emmanuelle. As usual, it was very interesting. And this is also the end of the first Arioneo webinar series. So I hope you all enjoyed it as much as we enjoyed preparing it. And so I'm going to send you the replay of the webinar later this week with the practical sheet that goes along. And so let us know if you have any feedbacks or any ideas that we could do for the next webinars. We are already planning some great stuff for the later year. Thank you.
Thank you so much. Take care.
Bye.
Bye.